If you are seeing me for the first time, fate has brought us together. Like, share, subscribe, and follow for more. Here's a detailed and insightful contrast between males and females in handling mental health issues, showing how gender differences shape emotional awareness, coping, and recovery. 1. Awareness and acknowledgement. Males often delay recognizing emotional distress or mental health struggles, tend to view mental health issues as a sign of weakness due to social expectations of toughness, more likely to ignore early warning signs. Females usually more self-aware and open about emotions, acknowledge stress, anxiety, or sadness more easily, more willing to discuss feelings and identify emotional changes early. 2. Expression of emotions. Males often suppress emotions, expressing distress through anger, irritability, or withdrawal. Use distractions, work, sports, or substances instead of direct communication. Females tend to verbalize emotions openly and seek emotional connection, more comfortable crying or talking about their struggles. 3. Coping mechanisms. Males prefer problem-solving or avoidance strategies. Engage in activities like exercise, gaming, or alcohol use to escape stress. Less likely to seek emotional support. Females use emotional and social coping, talking, journaling, or sharing experiences. More likely to engage in self-care, rest, therapy, mindfulness. 4. Seeking help. Males less likely to seek professional help due to stigma and fear of judgment. Often seek help late when problems become severe. Females more proactive in seeking counseling, therapy, or medical support. Open to discussing mental health with doctors, family, or friends. 5. Support systems. Males rely on small or limited emotional networks, often avoiding vulnerability with friends, may depend on partners or family as the sole emotional outlet. Females maintain broader support networks, friends, family, online groups. Use social relationships as a strong protective factor against depression and anxiety. 6. Common mental health challenges. Males higher rates of substance abuse, anger issues, and suicide. Depression may appear as aggression, irritability, or risk-taking behavior. Female higher rates of anxiety, depression, and eating disorders. Emotional distress often linked to trauma, body image, and relationship stress. 7. Response to stress. Males often resort to distraction or isolation under stress, struggle with emotional regulation, leading to impulsive or risky acts. Females use communication and reflection to cope, may become overwhelmed by overthinking, but are more open to emotional release. 8. Treatment and recovery patterns. Males respond better to goal-oriented, structured, and activity-based therapies, need encouragement to develop emotional literacy. Females respond better to talk therapy, group support, and holistic care. Healing improves through trust, empathy, and self-expression. 9. Social and cultural influences. Males. Cultural norms emphasize stoicism and self-reliance. Mental health struggles seen as unmanly. Female society often permits emotional expression, but may stigmatize emotional instability. Face unique pressures from gender roles and expectations, caretaking, appearance, etc. 10. Long-term resilience. Males build resilience through discipline, structure, and external motivation. Need more spaces to explore emotions safely. Females build resilience through connection, communication, and self-compassion. Healing often involves emotional release and support networks. Summary table aspect. Males, females, awareness. Often deny or ignore symptoms. Recognize emotional distress, early expression. Hide emotions, show anger. Talk openly. Express sadness. Coping avoidance. Distraction, connection, communication. Help seeking, reluctant, fear stigma, open to therapy and support system, small or limited, broad, and emotionally open. Common issues: substance abuse, suicide anxiety, depression, trauma, response to stress, withdraw or act out, reflect, seek help, recovery, focus, structure, and goals, emotional healing and empathy, cultural pressure. Be strong mindset, balancing strength and sensitivity, resilience path through control and independence, through support and emotional growth. If you are seeing me for the first time, fate has brought us together. Like, share, subscribe, and follow for more.